The definition of jowls is when this area here that I've colored in brown starts to look more prominent, heavy, and it starts to droop or sag beneath the jawline. And the cause of jowls is multifactorial. One of the reasons is loss of collagen and elastin as we get older and wiser, and the skin just becomes looser. Another reason is shifting and loss of fat pads and volume in the cheek, in the preauricular, and also in the pre-jowl sulcus. When these areas lose volume, the jowls lose their support and they tend to bunch up more. And as they bunch up more, they kind of get stuck on this blue thing. This is called the mandibular cutaneous ligament, which tethers and anchors the skin down to the bone. So everything kind of just bunches up behind it and it looks really heavy. Another reason is gravity. Gravity pulls everything down over time. Another thing that helps gravity are these muscles. The DAO and the platysma muscle are two muscles that pull the face or pull the mandible and the jawline down. So all of these things contribute to the formation of jowls. One other thing is bone loss and bone resorption. As we get older, our bone mass reduces and we lose bone along the jawline, and even the teeth start to shift medially, which again moves everything forward. And guess what? Yeah, it gets stuck behind this ligament. So the treatment for jowling is really multimodal, and each person has to have their own individualized plan based on what's going on with their face and what's causing their jowling. If you just have mild jowling because of the downpull of these muscles, then placing a neuromodulator in these muscles can really help minimize the downpull and give this area a lift. If you have volume loss in these areas, and I mean mild volume loss, then replacing the volume can bring back some of that support and also help camouflage the appearance of the jowls. If you have increased skin laxity, if you can pinch more than an inch of skin here, then really getting surgery would be your best option to get a noticeable result. And be aware of these devices that promise skin tightening and things being pulled back, because none of these devices actually tighten skin. They're skin boosters. They improve the tone and the texture of the skin, but they're not going to pull anything back. So make sure you talk to your medical professional and discuss your concerns and have them come up with a reasonable plan with realistic expectations.